now into a few techniques that can address the most problematic joints of this area. First of all, we talked about the SI joint. I'm going to get my pelvis here again. And just to show you what we're going to be doing here, I want to work with the ligament structures of the pelvis. I'm going to work with using some deep melting compression into those ligaments and combine that with some rhythmic rocking movement that helps to open up the SI joint a little bit. So if you watch that happening, that would be my finding the iliac crest, gently palpating my way around the iliac crest, and finding the posterior iliac spine here and letting my thumb go into that space, just posterior, just medial of that posterior iliac spine. I'm using a firm but non-painful pressure into those ligaments. I'm going to hold that pressure, and as I hold that pressure, I'm going to take my other hand and gently push the ilium away from the sacrum, leaning my body weight onto the ilium, and then create a very small, very slowly paced rhythmic rocking movement. And this should create a sense of space and relaxation. You might feel as you hold this for 30 to 60 seconds, you might feel how the joint begins to open, how it begins to relax. There might be greater space for your thumb to sink deeper into those ligaments. Another variation on this technique will be to, instead of working with the lower SI joint ligaments, to come up higher here and work with the iliolumbar ligament. And similar kind of pressure. And now instead of using a rocking motion towards the knee, I'm going to press the ilia down towards the foot end of the table and create a gentle little rocking movement. And this also will create some stretch on the SI joints and this iliolumbar ligament that's underneath my two fingers here. How's this feeling for you?
Great.
Great, she says. The SI joint tends to be the most problematic joint for most women. They oftentimes will walk into your therapy room with their hand over their SI joint, showing you how painful that SI joint is. So it's very helpful to have techniques for working in this area. The other place that many women really appreciate, that's a very simple technique that we can all incorporate into our work with a pregnant woman, is to stretch the lumbo-dorsal fascia and the muscles of the lumbar area. We could call this a lumbosacral stretch because it also stretches this lumbosacral joint, right? So what we're going to do here is to take a nice broad tool like the back of my fist here, and I'm going to place that on the sacrum, leaning my body weight in towards the sacrum, and then turning so that I am turning her coccyx underneath her torso. I'm stretching out the lumbosacral joint. My other hand is just resting here on her ilium. And she should feel this as a tremendous relief in her lumbar area. And she says, yes. I'm going to hold this for 30 to 60 seconds as well, as a minimum. And sometimes it can feel really good, if she's not nauseous, to do a tiny little rocking movement. Do you like the rocking movement too?
Yes.
All right, great. So this is very helpful for stretching the lumbosacral joint and all of the attachments in the lumbar region. If she had symphysis pubis pain, we would need to be working with that from a position in the semi-reclined position where we could do some resisted stretches here with adduction and abduction movements that would help to balance the symphysis pubis. One final thing that we might want to do here that you will find this sideline position gives you excellent access to is to the structures of the gluteus medius and the gluteus maximus. Structures that oftentimes are full of trigger points, have a tremendous amount of tension in them from the changes in walking and in gait that a woman has to make as she makes her way through her pregnancy. So we can use some deep tissue techniques for working with the gluteus medius, for example, so that I'm leaning my body weight again into a nice broad tool, working with the gluteus medius, waiting for tissue release to happen in that area, waiting for a softening to occur as fascial changes happen over time. And once again, this would be a 30 to 60 seconds minimum of time for those responses to happen. In addition to the gluteus medius, of course, the gluteus maximus attachments would be great to work with as well, and I can reach them again very, very easily from this position. And a final place that this kind of work might be very useful for would be in the space between her ischial tuberosity, right in here, and her greater trochanter, where many of those lateral rotators are crossing. And that can be very helpful in relieving that piriformis syndrome where that sciatic nerve is pressing. So we'll palpate and find those two landmarks, and using a smaller tool to work in these areas. Now, I've focused in on deep tissue work for these joints and these muscles, and I've also used small rhythmic movements. But of course, any type of circulatory work on the attachments or in the bellies of these muscles, kneading, cross-fiber friction, trigger point work as you identify those painful areas that are very common in the gluteus medius in particular, would be very helpful for this area. So finally, before we leave the pelvis here, I'd like to just remind you of a couple of safety precautions here. When you are doing the lumbosacral stretch, when you're pressing on the sacrum, it's very important that you use a broad tool like the fist of your hand, or perhaps you want to use the soft side of your hand here. That's because there are some points that are labor stimulative points that are on the sacrum. These points are related to the energy meridians of Chinese medicine, and it's important that we not inadvertently stimulate those points with a pointed pressure. So we're going to use a flat pressure of our fist or the palm of our hand on that area. Another thing for you to keep in mind as you work with someone who has peri-partum pelvic pain, especially if it's the symphysis pubis, is that we want to avoid any situation in which we would do a unilateral traction. So for example, I could traction the hip joint by pulling backward like this, but that can make a shift in the symphysis pubis. So that would be a technique that I would avoid doing, so that I would avoid pulling on one side of her pelvis and shearing or shifting at this symphysis pubis. And finally, because we are applying pressure on the back of the body here, if I am not directing my pressure correctly, or if I don't have firm supports that hold the woman securely on her side, I can wind up rolling her body onto her abdomen, and that's going to put some additional pressure on her belly. And intrauterine pressure is something that we're not quite sure how much of a risk that might be to a woman's pregnancy. So we're going to keep her on her side by the vector of the pressures that I'm using. Notice that I stabilize her pelvis when I do these techniques, right? When I do the sculpting work. And one of the reasons for these very firm supports of the side-lying positioning system, and remember I put another support underneath her abdomen over here, is to keep her on her side when I'm working in these very needy posterior structures. So I could spend, and I do spend, 32 hours at a time teaching therapists how to work with women during their pregnancies. This is just a little taste of a couple of ways in which you can address this very important area of the pelvis. If you're interested in more information about my approach to the pelvis and to pre- and perinatal massage therapy, please contact me, my books, my courses, my website. Thank you.